So the patient is a 69-year-old male involved in an unhelmeted motorcycle collision seen as a neurosurgery consult. Patient's reported head strike without loss of consciousness when he was struck by a truck today. Patient was initially brought to outside facility and then care flighted to MCP for higher level of care. On exam, patient is alert, able to answer questions appropriate. Patient complains of rib pain and left shoulder pain. So for past medical history, patient has leukemia, which he denies following up for. He was initially diagnosed by his primary care. He also has a history of umbilical hernia, and then he had a hernia repair in 2017. His social history: he denies alcohol, tobacco, or illegal drug use. He works in installing floors. He denies any prescription medications, over-the-counter medications, or herbal supplements. And he has no known allergies. For his review of systems, he was positive for headache, neck ache, shortness of breath, rib pain, left shoulder pain. He was negative for all other systems. For his vital signs on exam, his blood pressure was 116/71, pulse of 75, respirations of 22, temperature of 98.2, and O2 sat of 97 on 4 liters nasal cannula. CT of his C-spine showed multiple posterior left-sided rib fractures, a secondary small hemothorax, but no acute thoracic vertebral fracture based on CT. His head CT showed subarachnoid hemorrhage along the right temporal and parietal lobes. On exam, his neurostatus was GCS of 13. He was alert and oriented times 3, opened his eyes spontaneously. His pupils were round, brisk, equal, and reactive. He followed commands, moved all extremities, and sensation was intact. On CV, cardiovascular sinus rhythm on the monitor, S1 and S2 were heard. Pulmonary-wise, he had decreased breath sounds in the lower left lobe. His trachea was midline, and he had crepitus. Extremities, he had scattered abrasions, but all distal pulses were palpable. He had no clubbing, cyanosis, or edema. For my assessment, he was a motorcycle collision. He had right temporal parietal traumatic subarachnoid, multiple left rib fractures, small left hemothorax, and a left clavicle fracture. So plan from a neurosurgery standpoint is he's non-surgical at this time. Continue frequent neurochecks. Repeat CT scan in AM or sooner for neurodecline. Keep normotensive with a blood pressure less than 140. Continue Keppra 1 gram for 7 days. Hold DVT focal axis for the risk for extension of the hemorrhage. Pulmonary-wise, we're going to encourage insulin spirometer and adequate pain control for deep breathing. Monitor for worsening respiratory symptoms.